Welcome to the first video. This video we're going to talk about two things, but I'm only really going to cover one. So this one is the ABC's danger signs of pregnancy, and then at the very end I'm going to kind of briefly talk about this mnemonic that I found online, and I love mnemonics, and it's LARA CROFT. So this is causes for abdominal pain during pregnancy. I'll try to put a link of where I got this LARA CROFT because it goes into more detail. But let's talk about the ABC's danger signs of pregnancy. I think this is important to talk about because although this isn't like a specific complication, it is before the doctor can diagnose these complications, at least us as a nurse, we could be mindful of what to look for and what to monitor. So let's just get started. So the first one is A, abdominal pain. So if the mom is experiencing abdominal pain or epigastric pain, that could be due to several things. So the first one is liver. Is the mom having a swollen liver? If the mom has a swollen liver, that can be pointing towards severe preeclampsia, and we'll get into that when we cover that topic. But with the edema, that's what's happening is the mom's liver enzymes are super elevated, and not good, basically. It also can indicate that a convulsion is pending and it's about to happen. If the mom is experiencing abdominal pain at the end of her pregnancy, so in the last trimester, that can indicate abruptio placentae. So Time kind of talked about it where there's abruptio placentae. This is the painful one, and then there's placenta previa. That's painless, so don't get them confused. So now we're moving on to B. The first B is blurred vision. If the mom is experiencing blurred vision, that could indicate, does she have hypertension? Again, if we kind of think about the pathophysiology of hypertension. Hypertension is when the vessel is super constricted and a lot of blood is flowing through it really fast. And sometimes if the blood is flowing too fast and there's too much pressure, it could cause the small blood vessels to erupt. So the vessels that are feeding oxygen and blood to the eyes, that could erupt, which could cause a blurred vision. And like other organs too, like the small vessels that feed the kidney, it's all bad. Everything's bad. Okay, now we have the other B is blood pressure. We look at the mom's blood pressure. If it's really high, it could be related to preeclampsia and eclampsia. The next B is bleeding. So it's important to know that bleeding in any stage of pregnancy is not normal, and that is something to report to your doctor and seek help for. In the early stages of pregnancy, if the mom is experiencing bleeding, that can be indicative of a miscarriage, a spontaneous abortion, an ectopic pregnancy, or even the gestational trophoblastic disease, which is also called a molar pregnancy. And then bleeding in the later stages of pregnancy, in the third trimester, that could be indicative of abruptio placentae or placenta previa. Okay, moving on to C, chills and fevers. Chills and fevers is indicative of an infection. And know that this is never normal in pregnancy. We have to take care of that situation. As if I'm a nurse. Anywho, I'm a student. Okay, cerebral disturbances. So if the mom is complaining of headaches, that is a sign of severe preeclampsia. And then now on to our S's. The first S is swelling. Is the mom having edema? Edema in the periorbital or in her legs and feet, like in her hands. Again, edema is indicative of severe preeclampsia. And then the last S is sudden escape of fluid. So that's Is there like fluid running down her vagine? That could may be indicative of a premature rupture of the membrane. So those are our ABCs. These are danger signs in pregnancy. And then the last thing, I don't want to get into it too much because there's some things that I don't think we need to know, but I'm going to show you it anyways. The mnemonic is LARA CROFT. So L for labor, A, abruptio placentae, and so on and so forth. I'm going to try to attach this PDF where I got this mnemonic, and yes, so first video is done. Let's move on to the next video is going to be gestational hypertension.